doctors. My son has an almost any belly button that turns into a major outie after he eats. It's cute now, but I want to know what it's going to look like when he's a teenager, and if there's any procedures that he can get done if he's embarrassed.
Well, Angela,
I'm curious, how old is he?
He's 2 right now.
Okay.
Okay, and is it, well, we're looking at the picture. That is quite an outie. Is this something that he was born with? Has he always had this problem that his belly button would protrude either after eating or when he's crying?
Yeah, it's mostly after he eats. I can tell that it's a major outie.
Well, you know, given that history, I mean, that really sounds like this is going to be an umbilical hernia. For some people that have an outie, it may just be a remnant scar tissue of your belly button, which was that connection. It was the umbilical cord going from the placenta to the fetus. And when you deliver the baby, you cut the umbilical cord and you leave a stalk. For some people, extra scar tissue forms. You can see it, you can feel it, but it doesn't change. So in this case, most likely there's an opening in that ring, that connection, going through his muscle.
And pretty common in young babies, you know, I see it a lot, and usually you outgrow it. That ring kind of closes off over the first year or so, and we don't ever have to do anything about it. The hernias that tend to persist past a year of age, we usually, you know, see if that ring is closing down or not. If it's still getting bigger and bigger over the next couple of years, then we repair it. If it's kind of staying stable, we even let it go till age 4 before repairing it.
I think that's really the rule of thumb now. Yeah. Usually you wait till about 4. I mean, I repair these all the time in adults, women. After pregnancy, we see quite a bit.
Very common after pregnancy.
People that have lost a lot of weight.
What is important though? It's not really the pouching that the doctors check. It's more the size of the ring.
It's the ring, because what's happening, your abdominal contents are going through that patent ring. That's what's causing the outie. What we want to do, I love this prop right here. What we want to do is fix it to create an innie like so, right? Nice. And I'm going to show you how we do this surgically. I'm going to take you through it. We make a curvilinear incision below the belly button. We elevate what we call a flap of tissue. What you have to do is reduce the tissue that's coming through the abdominal cavity. You re-sew the abdominal muscles, rectus abdominis and the rectus fascia, so that makes sure that hernia ring is nice and tight, and sew up the skin, and that should take care of it. So, you know, in your case, you need to wait a little bit longer. Obviously, if he was to get sick, fever, that kind of thing, then you would want to immediately go see a pediatric surgeon or your pediatrician to check that out.
Okay, all right.
Or if that out-pocketing ever really changed, if it's suddenly really blue or red, if it changes color, that would be a sign that there's something stuck up in there, and that's an emergency.
And that's a great teaching point, Angela, for anyone at home who ever has a hernia. If you can't reduce it or push it back in, then it can become incarcerated or strangulated, doesn't get blood flow, and it can become a true medical emergency, but it certainly doesn't sound like that's the case with Pierce. Angela, best of luck. Thanks for your great question.
Thank you, doctors.